Welcome back to the EMT Spot's Blood Pressure Podcast. I'm Samuel Harrison, and I'm excited for today's deep dive.
And I'm Olivia Harper.
We're talking about a medication that plays a pretty crucial role, I think, for a lot of folks out there. ACE inhibitors.
Definitely. And ready to break down exactly how these medications work, their magic on blood pressure and more.
It seems like more and more people are being prescribed blood pressure medications these days. Is that your experience too?
Absolutely. Yeah. The use of medications like ACE inhibitors along with, calcium channel blockers and diuretics is definitely increasing as awareness about, managing blood pressure grows globally. It makes sense given how widespread hypertension is.
Okay, so let's unpack this a bit.
Right.
What exactly are ACE inhibitors and how do they work?
Okay, so ACE inhibitors stand for angiotensin-converting enzyme inhibitors, and they're like specialized traffic controllers for your blood vessels.
Hmm.
So think of it this way. Your blood vessels are like a network of highways. When they constrict, it's like traffic jams causing pressure to build up.
Sure. So ACE inhibitors help clear those traffic jams.
Exactly. They block an enzyme responsible for producing angiotensin II. It's a hormone that tells your blood vessels to constrict. By blocking this enzyme, ACE inhibitors allow the blood vessels to relax and widen, easing the pressure. Plus, they help your body get rid of excess fluid, further contributing to lower blood pressure.
So they're doing like double duty. But I've heard that ACE inhibitors aren't just for high blood pressure. What else are they used for?
You're right. They're quite versatile. One of their most important uses is for heart failure. They can improve symptoms, reduce the chance of hospitalization, and actually help people live longer with this condition.
Wow, that's amazing. Are there any other conditions where they're helpful?
Definitely. ACE inhibitors are often prescribed after a heart attack to support heart function and lower the risk of future heart problems. They can also help protect your kidneys, especially for people with diabetes who are prone to kidney damage.
Protecting the kidneys too.
Mhm.
That's really important. It sounds like these medications are kind of the superheroes of heart and kidney health.
Hmm.
But I'm sure they have some potential downsides,
Right.
like side effects.
Well, every superhero has a weakness, right? No medication is completely without the possibility of side effects, but it's important to remember that everyone reacts differently to medication. What might bother one person might not affect another at all.
So what are some of the side effects that people might experience with ACE inhibitors?
A common one is a dry cough, and it's actually pretty specific to ACE inhibitors.
Okay.
Some people might also experience dizziness, fatigue, headaches, nausea, or even skin rashes. Most of these are considered mild and tend to go away on their own.
Okay, those don't sound too bad. But are there any serious side effects to be aware of?
There are a couple of more serious ones that, while less common, are important to know about. Kidney problems can occur, and high potassium levels are another potential issue. And then there's a rarer but potentially dangerous side effect called angioedema.
Angioedema. That doesn't sound good. What is it?
It's a swelling of the face, lips, throat, or tongue. If anyone taking an ACE inhibitor experiences this, it's critical to seek immediate medical attention.
Definitely something to watch out for. So, we've covered the basics of ACE inhibitors, how they work, their benefits, and some of the potential side effects. But what about the different types of ACE inhibitors? Are they all basically the same?
Not exactly. Think of it like different brands of cars. They all get you from point A to point B, but they might have different features, fuel efficiency and handling.
Okay.
Similarly, while all ACE inhibitors work in a similar way, there are nuances in how they're absorbed, how long they stay in your system, and even their potential side effects.
So what are some of the names that people might see on their prescriptions?
Some of the most commonly prescribed ACE inhibitors are lisinopril, enalapril, ramipril, captopril, quinapril, and perindopril.
Got it. I'm guessing the choice of which one to use depends on the individual and their specific health needs.
Right. You got it. It's like, finding the right shoe has to fit your specific foot. The best ACE inhibitor for someone depends on factors like their medical condition, how they respond to treatment, and their risk for certain side effects.
I imagine having a good doctor is key in this whole process.
Absolutely. It's crucial to have a doctor who will consider all of these factors, work with the individual to find the best fit, and monitor them closely for any side effects or needed adjustments.
Speaking of adjustments, what about drug interactions? Are there medications people shouldn't take with ACE inhibitors?
There are definitely some important interactions to be aware of. For example, common over-the-counter pain relievers like ibuprofen or naproxen, also known as NSAIDs, can actually reduce the blood pressure lowering effects of ACE inhibitors.
Yeah, so taking those everyday pain relievers could make the ACE inhibitor less effective.
Exactly. And another important interaction is with potassium-sparing diuretics, like spironolactone. Combining these with ACE inhibitors can lead to high potassium levels, which can be dangerous.
Hmm. What other interactions should people watch out for?
If someone is taking lithium, using an ACE inhibitor at the same time can increase lithium levels in the blood, potentially leading to toxicity. It's really important to monitor lithium levels closely if both medications are being taken.
It sounds like there are a lot of potential interactions to keep track of. This is getting pretty complex.
It definitely highlights how complex medication management can be. It's always best to talk to your doctor about all the medications you're taking, even over-the-counter ones and herbal supplements, to make sure there aren't any potential problems.
Solid advice. So let's say someone is prescribed an ACE inhibitor. What are some practical tips for using them safely and effectively?
First and foremost, always follow your doctor's instructions carefully. Never try to self-medicate or adjust your dosage without consulting your doctor.
It sounds obvious, but it's worth repeating. What else?
Typically, ACE inhibitors are taken by mouth, and you can usually take them with or without food. Consistency is key, so try to take them at the same time each day to keep the medication levels stable in your body.
What if someone forgets to take a dose?
If you miss a dose, take it as soon as you remember. But if it's almost time for your next dose, skip the missed one and continue with your regular schedule. Never double up on doses to try and make up for a missed one.
And I imagine regular checkups with the doctor are important too.
Right, absolutely. Regular follow-ups are crucial for monitoring your progress, making sure the medication is working effectively, and catching any potential side effects early on. Your doctor can also make adjustments to your dosage if needed. It's a team effort to find what works best for you.
This has been really eye-opening. I'm learning so much about ACE inhibitors, how they work, their benefits, potential side effects, even practical tips for using them. It's amazing how much these medications can do.
It really is. ACE inhibitors can be a valuable tool in managing high blood pressure and a range of other conditions. But the key is using them responsibly and under the guidance of a healthcare professional.
Couldn't agree more. But before we wrap up this part of our deep dive, there's one more point we want to stress.
And that is the absolute importance of consulting your doctor before starting any new medication, especially ACE inhibitors.
You're listening to the EMT-SPOT's Blood Pressure Podcast. We'll be back in a moment with more on ACE inhibitors and why talking to your doctor is so crucial. Stay with us. We're back with the EMT-SPOT's Blood Pressure Podcast, and as we were just saying, it's so important to talk to your doctor before starting any new medication. This is especially true for ACE inhibitors because there's so much to consider.
You know, it's easy to get caught up in all the information available online these days. You can, research just about anything.
Yeah.
But when it comes to your health, nothing replaces that one-on-one conversation with your doctor. They're your, personalized guide, not a generic search result.
It's like having a custom-tailored suit versus trying to squeeze into a one-size-fits-all outfit. You'll always get a better fit with something, made just for you.
That's a great analogy. And your doctor is the expert tailor in this case. They have the full picture of your medical history, your current health, any other medications you're taking, and even lifestyle factors that might come into play. They can put all those pieces together to see if an ACE inhibitor is right for you and create a treatment plan that fits your unique needs.
It's like having a roadmap made just for you,
Mm-hmm.
instead of trying to navigate with a generic map that might not even include all the roads you need.
Exactly. And even if you've, done your research and think you know which ACE inhibitor might be best, your doctor might have other insights based on their knowledge and experience. They can also help you avoid potential drug interactions and make sure you're starting at a dosage that's both safe and effective.
Yeah, let's not forget they can answer any questions you might have, address any concerns, and really make sure you feel comfortable with the whole process. It's all about open communication and a real partnership between you and your doctor.
Speaking of partnership, your doctor will also want to monitor your progress once you start taking an ACE inhibitor. This involves, regular checkups to see how well the medication is working, how your blood pressure is responding, and to make sure you're not experiencing any side effects.
So it's not a set it and forget it kind of thing.
Right.
It's an ongoing process of monitoring, adjusting, and fine-tuning to make sure you're getting the best possible results.
Exactly. Sometimes the dosage might need to be adjusted, Or a different ACE inhibitor might be a better fit for, for your individual needs. It's all about finding what works best for you, and your doctor is your guide on that journey.
It's like having a personal trainer for your health,
Hmm.
helping you reach your goals and making adjustments along the way.
I like that. And let's not forget, your doctor is also there to provide support and guidance throughout the process. If you're experiencing any side effects, have any questions, or, just feel unsure about anything related to your medication, they're your go-to resource. Don't hesitate to reach out to them.
We've talked a lot about the importance of consulting a doctor, and it might sound repetitive, but honestly, it's just that important. Your doctor is your advocate and your partner in this journey. They want you to um, succeed and feel good about your treatment plan.
Couldn't agree more. We've covered a lot of ground today about ACE inhibitors, from the basics of, how they work to the different types available, the potential benefits and risks, and of course, the crucial role your doctor plays in this whole process.
It's really been a comprehensive deep dive, and I think the key takeaway here is that knowledge is power when it comes to your health. The more you understand about medications like ACE inhibitors and the importance um, of working with your doctor, the more empowered you'll feel in taking control of your health.
Absolutely. And that's what we're all about here at the EMT Spot's Blood Pressure Podcast, empowering you to take charge of your health journey. So as we wrap up this part of our deep dive, what's one final thought you'd like to leave our listeners with today?
I think it's this. While ACE inhibitors can be incredibly effective, they're just one piece of the puzzle when it comes to uh, managing blood pressure. Lifestyle changes are equally important, if not more so.
That's a great point. Things like, diet, exercise, stress management, and getting enough sleep can have a huge impact on your blood pressure, both independently and in conjunction with medication.
Exactly. So as you continue on your path to better blood pressure management, remember to look at the whole picture: lifestyle choices and medications. And always consult your doctor to find the best approach for you. They're your partner every step of the way.
And remember, managing your blood pressure is a journey, not a destination. It's about making sustainable changes, working closely with your doctor, and staying informed about, your treatment options. By doing those things, you can take control of your health and live a longer, healthier life.
Great advice. Now, before we move on to our final thoughts, we're going to take a quick break. We'll be right back with more on the EMT Spot's Blood Pressure Podcast. So stay tuned.
And we're back with the EMT Spot's Blood Pressure Podcast. It's been a fascinating deep dive into the world of ACE inhibitors today.
It really has. We've covered so much ground, from understanding how ACE inhibitors work at a molecular level, like those tiny traffic controllers for your blood vessels, to the importance of personalized medicine and working hand in hand with your doctor.
It's amazing to think about how these medications can not only lower blood pressure, but also have such a significant impact on conditions like heart failure and kidney disease.
Yeah, it really speaks to how interconnected our body systems are, and it underscores why it's so crucial to have a healthcare professional guiding your treatment plan.
Yeah.
They can help you navigate the complexities of medication management, taking into account your individual health history and needs. Absolutely. We've talked a lot about the importance of consulting a doctor, and it might seem like we're repeating ourselves, but honestly, it's just that crucial. Your doctor isn't just there to write prescriptions. They're your partner in achieving better health.
Exactly. They're there to help you make informed decisions, answer your questions, address any concerns you might have, and make sure you feel, comfortable and confident in your treatment plan.
Yeah.
It's a two-way street, and open communication is key.
So as we wrap up today's episode, what's one final takeaway you'd like to leave our listeners with?
I think it's this. While ACE inhibitors can be incredibly effective, they're not a magic bullet. Remember those lifestyle changes we talked about earlier? Things like, diet, exercise, stress management, and getting enough sleep.
Oh.
Those play a huge role in managing blood pressure, too.
It's like having a toolbox for better blood pressure management.
Right.
ACE inhibitors are a powerful tool, but you need the other tools in the box as well. Healthy habits, regular checkups with your doctor, and open communication about your health journey.
That's a great way to put it. It's about taking a holistic approach to your health. And your doctor is your guide in putting together the right combination of tools for you.
So for all our listeners out there, remember that managing your blood pressure is an ongoing process.
Absolutely.
It's about making sustainable changes, staying informed about your treatment options, and working closely with your healthcare team to create a plan that's tailored to your individual needs.
And remember, you're not alone on this journey. Your doctor is your advocate and your partner in achieving better health. Don't hesitate to reach out to them with any questions or concerns you have. Together, you can take control of your blood pressure and live a longer, healthier, and more fulfilling life.
Couldn't have said it better myself. That's all the time we have for today's episode of the EMT Spot's Blood Pressure Podcast. I'm Samuel Harrison.
And I'm Olivia Harper. We hope you found this deep dive into ACE inhibitors informative and helpful. Remember to subscribe, like, comment, and share this episode with your friends and family. And most importantly, take care of your heart health.